and today I'm going to discuss about the breast cancer. I thought of discussing this because this is one of the common cancers that has been found in Asia along with the cervical cancer, and many times a woman tend to neglect the symptoms that are given by your body, and as such we have a lot of mortality rate with respect to this cancer. Again, I would like to iterate that all the cancers are curable if they're detected at an early stage. So you can get 100% cure even if you have a cancer, but only the thing, it needs to be detected quite early. That's why with that intention, I have kept this particular session. So what are the topics that I'll be discussing is, first of all, what is a cancer? I'll be giving you an overview of a breast cancer. What are the symptoms that you can get in a breast cancer? Different types of breast cancers, and also some rare breast cancers which are also available. I'll be making you aware of it. Inflammatory, triple negative, metastic breast cancer. All these are a type of a little bit of a rare breast cancers, but still they do occur. Then what are the different stages of the breast cancer? How we can carry out diagnosis, wherein I will be explaining breast biopsy. Then I'll be explaining what are the treatments that we have in order to deal with the breast cancer, and how common is breast cancer and the survival rate. Further, I will also highlight on the risk factors, what are the preventive measures that you can take, along with a self breast examination, which every woman has to go through it for early detection of the cancer. So now, what is a cancer? A cancer is nothing but, in simple terms, your body produces the cells, and those cells has a particular lifespan, and after that they have to die and new cells has to grow. Now if some mutation occurs within these cells, then instead of these cells being dying, they simply go on multiplying, and as such it ultimately results in the formation of a cancer. So when we say a cell starts growing in comparison to a normal pattern that it has to follow, it ultimately results in the formation of the cancers, or basically it's the body's normal control mechanism of producing new cells and triggering the death of the old cells. When it stops working, that's where the cancer comes into picture. It can be any sort of a cancer in your body. The same mechanism follows. So the old cells do not die, and instead they grow out of the control, forming new abnormal cells, and it ultimately results in the generation of the tumor or the leukemia. Leukemia is a type of a blood cancer, but in the breast cancer, we are going to focus more on the tumors. So what happens is these old cells fails to die, new cells starts producing, and they start producing in an abnormal way. And as such, its normal functionality, what a cell is supposed to do, gets hampered, and ultimately it ultimately results in the development of the tumor or the leukemia. Now, what are the common cancers? So there are different types of the cancers that are being you will be aware of, like lung cancer, colorectal cancer, breast cancer, cervical cancer, prostate, ovary, uterine. All these are the cancers which are specifically pointed out with respect to the woman, of which the breast and cervical are quite common, and they are also being treated as one of the highest particular cancers in the womb. No doubt, the other cancers are also equally occurring in many women, but most common that we have found out are these two, and of which we are going to focus right now on the breast cancer. Now, first of all, to go with your breast cancer, you need to first identify your breast, because when we say you have got a breast cancer, there are different types of areas wherein you can get the cancer. Many times we don't know and we simply say that it is a breast cancer, because you should also know in which areas you can get the cancer, and based on that they are categorized into different sections. So to know them, first you should know what goes inside your breast. So if I take this particular picture, this is what is your breast structure is about. So you will have your nipple, you will have your areola. From outside, what is visible in your breast is only this thing. So your nipple, areola. Then you will have this particular lobules. You will have lactiferous ducts. So these are the ducts that are connecting ultimately through your nipple, and they are responsible for carrying your milk. Then your mammary glands, which will be present, that will be responsible for production of the particular milk. Okay, you will have lobules, and outside this area, you will have the fat. So it basically comprises of nipple, areolar region, lobules, ferrous ducts, and your fat, which is totally contributing your breast. And the cancer can occur at any of these particular areas or more than one area, and based on that, it has been basically categorized. Now, let us now come back to a breast cancer in detail. So if you take a frontal view of the breast, this is your nipple, areola, these are the ducts, these are your lobules that you see, they are carrying through these ducts. And you also see some ducts over here, which we basically call as the lymph nodes. So basically you will find them connecting your breast tissue here. You will also find it underarm, and they also tend to move upward towards your thoracic region. Side view of the breast is these are your lobules. Okay, these are your ducts. Lobules are basically mammary glands. Then ducts carrying the milk supply, ultimately connecting them to your nipple, right? And these are the fat deposits that you see in the outer region. So breast cancer basically occurs in the breast cells. So when I say breast cells, it can be any one of these particular cells that you see in the breast. And basically, it can occur either in the lobules or in the duct of the breast. So most common places where a breast cancer can occur is the lobules, that is this, or it can occur in the ducts that are carrying, which are ultimately connecting to your nipple. It can also occur in the fatty tissue or the fibrous connective tissues within your breast. So here also it is possible to get the cancers in all this particular fatty tissue that you see. The cancers often invades other healthy breast tissues and can travel to a lymph node under your arm. So the possible places where you can get a cancer is the lobules. It can be the glands. It can be your fatty tissue. And if it has gone one step ahead, it can go to your lymph nodes that you see here, and through which it can propagate to the other area. So all these particular places you may get a cancer, and based on that we have different category of the breast cancer. So we have a particular misunderstanding that when we say a woman has a breast cancer, that means entire her breast has been affected by a cancer. It could be one of the case, need not be always. And sometimes only some part of the particular breast are affected, which can be cured very easily compared to the early detection. Okay, and from the lymph node, so if it goes to a lymph node, from the lymph node it can spread to other parts of the body, and that we basically call it as a stage 4 or the last stage. I'll be coming back to it in a later stage. So these are the different places wherein you can get the breast cancer, and now we are going to go into a little bit more detail about each one of them. So what are the symptoms of a common breast cancer? So first thing, we will feel a breast lump or a tissue that is thickening and that feels different from the surrounding tissue, and you feel that this kind of thickness or a lump is observed quite recently. So always look out for any lump or a tissue that is thickened with little bit compared to the surrounding area that you find in your breast. You will feel a breast pain. You will feel red, pitted skin around your entire particular breast. You may feel a swelling in all or a part of your breast. You may feel only a part of the breast is swollen or the entire breast is swollen. You may feel a discharge. Other than the breast milk, you may also have a bloody discharge or a small drops of the blood are coming out. That could also be an indicator of the cancer. You may feel a lump or swelling under your arm. Okay, that is when the cancer has invaded your lymph nodes which are present under your arm. And if you feel a swelling under your arm, then it could also be an indicator of the breast cancer, but not always, because there are other reasons why you can also get the swelling under your arm. Next is sudden unexplained change in the shape and size of your breast. That's why examining breast regularly is very important. You may find your nipples have inverted. You may find changes in the appearance of the skin color around your breast. A part of the breast is in one color, one skin color, and the remaining part looks slightly different. That could also be an indicator. A lump or swelling under your arm, as I suggested here, that is also a particular symptom of your breast cancer. So, looking at these symptoms, one is redness of your breast. You may find one breast is swollen compared to the other one. It may be any one of the breasts. You may feel a pain or the itchiness of the breast. You may feel a thickening of the skin of the breast, and a part of it is dimpled. You may feel that the swelling has occurred in your underarm, so that's why it has propagated to the lymph node, and ultimately it has also affected the lymph nodes under your arm. That's why you may feel the swelling under your particular arm. So all these things are an indicator of the breast cancer. Again, try to looking at a more specific case. You may find a lump in the breast. You may feel a pulled out nipple. A nipple is little bit descending, you may find, which is not observed in the other breast. You may find little bit of dimpling. You may find dripping in the case of little bit of the droplets of the blood. Then you may find rashes or redness in the breast, a part of the area or a major chunk of it. You may also feel a little bit of skin changes in your breast. So all these things are probably the sign of a breast cancer. So here I put the live pictures also. So you will find this thickening of the area part that you see here compared to the other area. You may also feel that this is an inverted nipple that you see. If you see this images, one breast is swollen. Here one breast is swollen and it will be reddish. Here also you may feel a difference between both the breasts. Here you will find dimpling effect in this particular breast. This is in the case of inverted nipple, discharge from the nipple, right? And so, and you may also find a small spots in your part of the breast that is also an indicator of it. These are the images which has taken you to a next stage. If not treated early, then ultimately it can lead to this stage, and that's why I don't want any one of you to go to this particular stage in the worst case. That's why early detection is very important, and that's why I've created this session so that you can identify if at all there is any abnormality observed well in the starting stage, and there are 100% chances of getting it cured. Now, what are the types of cancers? We have different categories of the cancers, as I said before, based on the location where it occurs and also based on the way it spreads to the other part. So we have two broader categories, that is invasive and non-invasive. Invasive is the one that basically spreads from the duct and the glands to the other part of the breast. So invasive, it spreads from the ducts and your glands, mammary glands, and from there it spreads to the other part of the breast. Non-invasive, it doesn't spread. It is more confined to the original tissue. It can be the duct or it can be the glands or the globules, and it is more confined to that area itself. It is not spreading. So in that category, we have something called as the ductal carcinoma, which is non-invasive. That is, it is very specific to that, occurring only in the ducts. Then we have lobular carcinoma, that is confined to the glands which are responsible for producing the milk. We have invasive ductal carcinoma also. This occurs in the ducts, but it has also the capability of spreading to the other part because it is invasive in nature, and it is also most common, and it can spread to the other tissues of the breast as well because it is invasive type. We have invasive lobular carcinoma. It occurs itself at lobules, and from there it can spread it to the other parts. And further, we have less common types, but it can still occur. It's a pageant disease of the nipple. So cancer can start at the nipple area itself and can affect further to your areolar region. So it begins in the duct of the nipple, but as it grows, it begins to affect the skin and the areola of the nipple. So its origin is all those ducts which are ultimately connecting the particular nipple, and then as it grows out, it tries to spread and can affect your areolar region. Then phyllodes tumor is there. It grows in a connective particular tissue of the breast, and most of these tumors are benign. So if you have got phyllodes tumor, it is benign, means it is non-cancerous. Okay, it is non-cancerous. So it can be removed. You don't have to particular take an alternative therapy to treat it. So that is one good thing about it. Angiosarcoma is another type of that is less common. It basically grows on the blood vessels or the lymph vessels in the breast. So angiocarcinoma are basically it's a cancer that is related to your lymph vessels, which are connecting to a different lobules or the mammary glands in your particular breast, and it can also occur at that place. So from this, you will have a clear idea which are the different categories of the cancers based on the way it spreads. And the second thing is what are the different places wherein you can get this particular cancer. And based on that, we have come up with different categories. Because for a lay person, the breast cancer means it can affect the entire breast. But nowadays, I feel every woman should understand this inner intricacy and try to have or try to spread more knowledge about the same and get yourself well knowledgeable regarding this. So based on the previous slide, I will further categorize the different categories of the particular cancer. So this is ductal breast cancer. It is affecting only the ducts. If you see here, if you see, it is lobular. It is only the lobules that have been affected. Ducts are not affected. You can have a mixed tumor wherein both the particular lobules as well as the ducts both are affected. You can have inflammatory type of blood cancers wherein there is an inflammation that is seen in a part of your breast. And further, you have mucinous breast cancer, which can affect any part of your particular breast. Okay, so these are different categories of the particular breast cancer, and which are the different locations where they can occur is been highlighted. Now, apart from this, we also have inflammatory blood cancers. So these cancers are a little bit more aggressive type. If you have other type of the ductal cancer or the glands lobules cancer, they are quite manageable. But if we go for an inflammatory particular breast cancer, they are more aggressive type and they tend to spread more quickly. So what they do, they block the lymph nodes near the breast. So lymph which was nodes which was connecting from your underarm and other particular areas in the surrounding region of your breast, those cells gets blocked. And as such, the lymph vessels in the breast can't drain the fluids from your particular breast, and your breast tends to get swollen. So as such, it gets the name inflammatory. So they are blocking the cells from your lymph node. As such, the common exchange that happens between your lymphatic node and the breast doesn't take place, and it results in the saturation of the fluid in your breast, and that results in the inflammation of the breast. So it creates the breast to swell. You may look red and feel very warm, and over a period of time, you may also get a burning sensation or itchiness in the breast as well. So about 1 to 5% of the women do get it. Next category is triple negative breast cancer. In this, basically, it occurs when a woman lacks estrogen receptors or progesterone receptors. Now, one thing we need to take into account is there is one hormone called as prolactin that is responsible for producing your milk. And whenever you're pregnant, definitely these prolactin levels are going to increase. That is going to promote your breast secretion. Now, ultimately, the control of this prolactin is controlled by estrogen and progesterone. And if a woman lacks these receptors to receive the signals at the right time, then this particular glands can go for a toss. And that's where this particular triple negative breast cancer can come into picture. So it also have additional HAR2 protein on its surface, which makes it more difficult as for this to be a recipient, and that's where the spread is more faster. I will not go into the details of this, but since most of you are aware of estrogen and progesterone, I have spent more time on that. These are more intricacy to the medical thing, and also this cancer has a tendency to spread very quickly. If you get this, it is difficult to treat because we are lacking the receptors, and as such, most of the treatment that goes at these levels of the cancer are basically to deal with the receptors. So whatever medicine that we're sending to your body, they need to be received properly. And since the receptors itself are damaged, this particular cancer is little bit difficult to treat, and about 10 to 20% of the women get sick. Again, having said that, if early detection is done of this, definitely a woman has a good survival rate. Okay, so still the mortality rate is comparatively less, even when 10 to 20% of the women are affected with it. And most of the common particular cancers that is being found are either your ductal cancers or your lobar cancer, and about 1 to 5 with inflammatory, and about 10 to 20% with the triple negative cancer. So these are some of the images. So you may feel here that the outer area is little bit swollen and that saturation of inflammation has occurred. Here this is another example of inflammation. So you will see a substantial amount of the fluid has accumulated and has resulted in the swelling of the breast. This again image, if you see, it has almost reached the entire particular breast, and a lot of inflammation you will be able to see in comparison to the other breast, which is quite clear here. Okay, so these are the images which are pertaining to this cancer. So you may not feel from outside there is anything wrong as such, but with a closer examination, you will be able to see this kind of changes. And it is very equally important for every woman to do the breast examination on a regular basis to detect any significant changes or any minor changes in the early stage. Now, we also have one more type of cancer, that is metastic breast cancer. So this is basically a cancer wherein we have reached almost stage 4. The cancer has spread over entire breast. It has also affected your lymphatic node. And lymphatic node, as I said before, is a channel through which a cancer can spread to other parts of the body. Okay, and if that happens, we basically call it as a 4-stage cancer. And this is a type of the 4-stage cancer. So it can spread from the breast to other parts of the body, such as your bones, lungs, liver, because it has now invaded your lymphatic nodes, and lymphatic nodes is ultimately connecting to your other parts of the body through which the cancer can traverse. So basically, an image that we see here is basically metastic breast cancer. In most of the cases, we need to extract the entire breast to overcome this. Plus, a particular good chemotherapy needs to be given, but still mortality rate in this is still high. Now, what are the stages of the breast cancer? This is very important to understand. Okay, the stages are based on how large the tumor is and how much it has spread. And I would also like to point one more thing, is in which area it is being present. So we categorize the stages based on the size, based on how much is the spread, and which area is basically affected by that tumor. Okay, so doctors stages your cancer based on the following. So if the cancer is invasive or non-invasive, okay, how large the tumor is, whether the lymph nodes are involved, whether it has reached the lymph nodes or not, is the cancer has spread to nearby tissues or it is localized, as I was told you before, whether it is localized to either the duct or your lobules, or whether it has spread from one area to the other area, okay, or whether it has reached the lymph node, or whether it has reached the It's the vicious fight that is involved. So based on that, the doctor is going to categorize in which stage of the breast cancer you are in. So there are different stages like stage 0. In stage 0, it is the starting phase. So remain confined to the ducts in the breast and have not spread into nearby tissues. So first part that is affected is either ducts or the lobules, and it is more common type of the breast cancer in many women. So stage 1. So in stage 0, it is only located to the ducts and it has not spread anywhere. Stage 1, we have two, 1A and 1B. In 1A, primary tumors is basically about 2 centimeter. So here the size comes into picture. So if it is of around 2 centimeter wide or less, and the lymph nodes are not affected. So it may be 2 centimeter, it may be either in the ducts, or it can be in your particular glands also, but your lymph nodes are not at all affected. Then it comes under category of 1E. 1B, the cancer is found in a nearby lymph node, and either there is no tumor in the breast or the tumor is smaller than 2 centimeters. So it might have affected your glands, it might have affected your ducts, and also some part of the particular lymph node, but its size is comparatively smaller, less than 2 centimeter. Then it comes under the category of 1B. Then we have the next stage as stage 2, 2A. The tumor is smaller than 2 centimeter and it spread to at least 1 to 3 nearby lymph nodes. Or it is bigger in size and haven't spread to any lymph node. So under 2A, these are two options. It may be smaller in size, but it is spread to multiple lymph nodes. Other thing, it is big, but it has not yet affected the lymph node. So that is under 2A. Under 2B, the tumor is about 2 to 5 centimeter and has spread to at least 1 to 3 auxiliary armpit lymph nodes. So under your arm, there are lymph nodes. So if it has affected at least 1 to 3 of your auxiliary armpit lymph node, then definitely it comes under stage 2B. And if it is larger than 5 centimeter and hasn't spread to any lymph node, still it comes under the category of 2B. So now the size is bigger, but the lymph node are not at all affected so far. So still it comes under category of 2B. Under stage 3, we have cancers which are of the size that can go to up to 9 centimeter. And the auxiliary lymph nodes have been enlarged. Your inner mammary lymph nodes and the primary tumor can be of any size. So anything between 4 to 10 centimeter, your lymph nodes are affected, your mammary gland is affected, your ducts are affected, that will come under the category of 3A. And the tumors that are basically greater than 5 centimeter and are spread to at least 1 to 3 auxiliary lymph nodes are come under this category. Okay, so we try to categorize it based on the size and the area that is being affected. 3B comes as a tumor that has invaded the chest wall of the skin and may not have invaded up to 9 lymph nodes. So now under the 3B category, the tumor may not have practically invaded the lymph node. I mean the large chunk of the lymph node, but definitely it has invaded to the skin in the sense those fatty tissues which have been present. Then it comes under 3B. 3C, the cancer that has been about 10 centimeter or more, and wherein again your lymph node and your internal mammary particular nodes, if all are affected, then definitely it comes under the category of 3C. So based on these stages, if you see, based on the size, the location, and the area to which it has spread, we have categorized your breast cancer into different stages. We also have the last stage, as I also mentioned you about in the past, stage 4, when the cancer can have the tumor of any size. So any size in the sense, it will be definitely exceeding 10 centimeter. And the cancer cells are spread to nearby lymph nodes as well as the distant organs. So it has traversed all the way from your lymph nodes, and maybe your liver, maybe your stomach, and other particular body organs are also affected because of it. Then we term it as a stage 4. Now, if you see this diagram, I have explained stage 0. It is localized to any one, basically your ducts. Stage 1, if you see, the size has increased to 2 to 4 centimeter. Stage 2, then there are multiple growths that you see here. Stage 3, it has occurred in more than one lymph nodes and maybe also underarm. And stage 4 is when it has traversed from your breast, it has traversed through a lymph node, it has reached here, it has reached your lungs, it has reached your liver, and so on. So other organs are also affected because of this cancer. That is when we term it as stage 4. So it is not at all restricted to the breast. It has gone to this, even it can traverse to your brain as well. Okay. So this is when we say the breast cancer has reached stage 4. Okay. Here, inflammatory breast cancer, I have tried to put one image here. So wherein you say you will feel inverted nipples in most of the inflammatory breast cancer scenarios. You may feel the skin has a pitting, small poking things you will find, and it is most of the time reddish in nature. So this is inflammatory breast cancers, and basically your stage 4 are more of inflammatory or the triple particular cancer that we have seen. Basically, these two cancers comes under those category, basically the stage 4. But the common ones that we find are either stage 0, 1, 2, okay, and a part of 3. More complicated is stage 4. If you neglect it or if you don't approach your doctor uh, at early stage, then you can go to this stage. Now, what is the diagnosis? The first and foremost is the breast examination. So I will explain you how you need to do the breast examination later on. Mammogram is a common way to see how the surface of the breast is by doing imaging test. It's a sort of an X-ray of the particular breast. And women above 40 years should basically do this mammogram once a year. Okay. Second one, if we detect something in the mammogram, we go for ultrasound method. So ultrasound is going to create the picture of the tissues deep in your breast, and it is going to distinguish between a solid mass such as a tumor and a benign cyst. So you may also find a cyst in your breast which is benign in nature, that means non-cancerous. So it will be able to distinguish whether it is a cyst or whether it is a tumor. So mammogram is detecting something, and now to get a more clarification, we may go for ultrasound, which will further try to detect or segregate it into either tumor or a cyst. Then if required, we can go for breast biopsy. So we try to remove a tissue sample from the suspicious area from the ultrasound, and we send it for the laboratory test, that is a biopsy, what we basically call, and then further analysis can be found out whether it is actually a particular cancer or whether it is a benign cyst can further be evaluated. So this is how a mammogram is basically done. So this is the image that you see. It's a sort of an X-ray in a simple term of your breast, indicating the inner particular parts and the functioning of your breast. These are more images. So internally, if you see here, this is a cancerous area that you see in the breast. It has invaded some part of your lobules. Here also, it has tried to spread in some other areas. Fine. This is a major sort of an inflammatory particular cancer that has spread almost the entire breast. Okay. Then we will find this particular cancer is more inclined towards the nipple area, and then as I said, it may spread up to the areolar region. Here you may see the symmetric nature. This is more of the particular cancer, that is a ductal cancer. All the ducts which are there are being affected. Okay, not much lobular particular things you observe here. Like in this case, this is of more of lobules. This is more of the ducts. Okay, this one you may feel this is nipple. This is the areolar region, and here you will find some particular lobules are also affected, along with some part of your ducts. So it can be a combination of both this particular type of the cancer. Now, what are the treatment strategies? So breast cancer stage, how far it has invaded. So treatment strategy will depend upon in which stage you are, and in which stage you are is ultimately determined by all those factors which I had explained you before, and how big the tumor has grown. And also it also depends on the rate at which the particular tumor is growing. So that is also important factor in deciding your treatment. And what are the options available to you? One is the surgery, wherein a part of the breast that is affected area will be removed with the recreational surgery to get your breast back in the original shape. There is a radiation therapy that is available. Radiations are indirected so that your cancerous cells they die or it prevents it from multiplying at a faster rate. Chemotherapy is another particular therapy that has been given, and nowadays a lot of good advancement has taken place in these medicines. So whatever side effects of the chemotherapy, radiation therapy, which was there about a particular decade back, is no longer there. We also have metronomy, a particular therapy that is available, which can also be effectively used to treat this kind of patients with very less side effects. Okay, so we have also hormonal therapy that can also be used to take care of some certain cancers, because one type of cancer, as I told you, was pertaining to the prolactin, which is a hormone. So those particular strategies can also be treated. So in surgery, we have something called as lumpectomy. We remove the tumor and surrounding tissues, leaving the rest of the breast intact. So only the affected part of the breast is removed under this type of the surgery. Mastectomy, we need to remove the entire breast if the spread is wider domain, and to prevent it from further spreading it to the other part of the body, we may have to go to mastectomy, that is the entire removal of the breast. We also go for sentinel node biopsy. We remove a few of the lymph nodes that has received a drainage from the tumor. So we can also be more localized and try to remove only the lymph nodes which are affected. That is termed as sentinel node biopsy. We can further go for the axillary lymph node dissection. So if the lymph nodes removed during the sentinel node biopsy contains the cancerous cell, then we can further particular go here and do the auxiliary lymph node dissection. So first sentinel has been done. We remove the content from the lymph node, send it for the analysis, and if we see that it is having a particular cancerous cells, then we may go for the auxiliary lymph node dissection. So these are as far as some of the surgical procedures that are being involved. Radiation therapy, high-powered beams of radiations are used to target and kill the cancer cells. More radiation treatments are external beam radiation, so it is not invasive in nature. It is being done through the external radiation. Then gadget therapy is also can be given in alternation with the radiation therapy, or a good combination of both of them can also be done. Chemotherapy, we induce drugs that is used to destroy your cancer cells, and usually given either before surgery or shrink the tumor. So chemotherapy can be started early so that we shrink that particular tumor, and once it is shrink, then a surgery can be performed if required to remove that particular tumor. And sometimes with the chemotherapy itself, the tumor can be treated without any surgery as well. It depends on which stage you have reached, what is the size, the different schemes of the treatment or combination of more than one is being decided. Okay, so it has side effects, but as I said, the chemotherapy drugs that are available nowadays are much more particular advanced, and they show very less side effects compared to what they were before. Hormone therapy, so if the cancer is sensitive to hormones like the prolactin, particular hormone, triple negative, what I said, like the estrogen, progesterone, which are two female hormones, can stimulate the growth of the breast cancer tumors, then we can use this particular hormone therapy to control this particular hormone so that the spread of the particular tumor can be reduced, and then ultimately surgery can be performed to remove. Therapy works by blocking your body's production of this hormone. So that is how the hormone therapy takes into account. But if you are in your reproductive age group, then definitely with this kind of mode of treatments, your other particular menstrual cycle irregularity, then chances of conceiving, they may be hampered, because they are also estrogen, progesterone are important hormone contributing to your menses. So if we are controlling to take care of the breast cancer, then your other scenarios can also get hampered. Medications is Herceptin can block your body's production of the HER2 protein. So that is basically in the triple negative particular cancer, which is expanding very fast. We can give this medicine to control the spread of this particular cancer quickly. So it helps breast cancers to grow. So it's basically HER2 is a particular protein that basically helps the cancerous cells to grow. So by preventing the production of this particular protein, we can keep the particular cancer under control. So how common is the breast cancer? It is one of the most common particular cancers. And if you see this, both the diagrams, global cancer incidence, if you see, is here. So if you see in this particular purple area, it is contributing to your entire Asia region, which is contributing to almost 48.4, almost I would say 50% of the breast cancer cases are coming from the Asia, right? And if you see other advanced countries, it is very low because there the women are more aware of the changes. They are doing self-examination, taking all preventive steps at early stage, and that's why the detection is much less and the occurrence also is much less over here. And what is striking over here is in the next particular slide here in terms of the mortality. Number of deaths that you find in the Asia is now contributing to almost 57.3 compared to the other particular countries. Probably this is because the woman detect the particular cancer at a late stage, because if you come at stage 4 and all, then chances of you being surviving are comparatively less. I would not say 0%, but it is comparatively less. So that's why early detection and early particular treatment strategy is the best one to take care of this. Now, risk factors for the breast cancers are your age is the most invasive breast cancers. It is basically found. Invasive breast cancers are found in a woman that is above the age of 55. If you're drinking alcohol or if you're having dense breast tissues, so dense breast tissues makes mammogram hard to read. And as such, even if the cancer growth is occurred, it cannot be detected by a mammogram itself. So if your breast tissues are dense, then definitely some of the cancers which are invading may be just skipped by a mammogram, okay, which you are doing on a yearly basis, which is a must. Second thing is in your genes itself. If you have a BRCA1 and BRCA2 gene mutations, then you are more likely to develop this kind of cancers. And again, it depends also on whether you have acquired these genes from your parents or from your hereditary. Early menstruation is also one of the reasons found. So if you have your first menstrual period at the age of 12 or below that, nowadays we see that the girls get the particular menses as low as 9 or 10 years. So they are also more prone to getting breast cancer in the later stage. Giving birth at an older age, a woman who have the first child until the age of 35 is equally 40% more likely to get a breast cancer compared to a woman who already have given at least one birth below the age of 35. Hormone therapy, a woman who took more than one post-menopausal estrogen and progesterone medication to reduce the sign of menopause symptoms also have a higher risk of breast cancer. Also, I would like to highlight one more thing here is this point has been put up with respect to a woman who are in the menopause phase, wherein we are giving the hormonal therapy to control progesterone and estrogen, because at that time a woman may find a heavy bleeding and she is already approaching towards her menopause. Other aspect I would also like to highlight is many times we go for an alternative pregnancy. Okay, that is by using IVF or IUD, and at that time a lot of hormones are being injected in our body for different stimulations, and those can also are contributing factors for increase in the breast cancer, which you realize after passing on the therapy after some years. So probably that particular thing which you have tried out for conceiving can also be contributing factor in your later stage of your life to get something like a breast cancer. Okay, and many times I've seen a woman who is contributing or who is repeatedly going for a cycles. You can just imagine what risk you are putting your body itself to this kind of things. you can have inherited risk if your parents or if you have a family history, then you may also have more likely to get this. Let menopausal start. So women who do not start the menopause until the age of 55 are also more likely to get the breast cancer. So early menopause is also at risk. Late early menses is also at risk, and the late menopause are also at risk. The women who are never pregnant, okay, who have never become pregnant even once, they are also at a higher risk of getting the breast cancer. And if you have a previous breast cancer history on one breast, then there are also chances of redeveloping it again, or maybe it may have spread to the other breast, or other breast itself may have started altogether the growth of the cancerous cells. So these are the risk factors for the breast cancer. Now, what is the survival rate? It depends on the type of the cancer, the stage of the cancer at diagnosis, so that is very important. And other factors also plays a role, including your age and the race. Okay, race in the sense in terms of the genetic material. So basically, we have seen that there is a tremendous amount of the increase in the breast cases, cancer cases. Okay, so of 2010 to 20, we have almost touched about the 90%, right? And there are also the survival rate that has also increased because of the increase in the treatment procedures. So if 2 decades back, if you had breast cancer, and anyone would have said, okay, I'm going to die, but that is not the case today. But provided you do the early diagnosis, and if it is detected in the early stages, it is very much 100% curable, as I have told you before. And what are the things that you can do to prevent? First and foremost, lifestyle factors. Obese women are much at a higher rate of getting a breast cancer or any cervical cancer or any other type of cancer. So maintaining a good BMI index, that is body to body mass index, that is the ratio of your height to your weight, is very important. Balanced healthy food is very important. Try to have green leafy vegetables, avoid red meat, okay, dairy products, then more of the sugary products. Good exercise is very important in whatever form, walking, going to the gym, okay, cycling, whatever, swimming, do it. Screening is very important. As I said, a woman at the age of 40 to 49, an annual mammogram isn't recommended, but women should discuss their preferences with their doctors. So usually I would suggest once you cross 40, definitely try to have a mammogram at least once in a year or once in 2 years. We don't anytime go for a mammogram, and that's why in Asia the detection occurs at a later stage, and that's why you see a lot of mortality and the increase in cases in Asia compared to the other countries. Okay, women above the age of 50 to 75, a mammogram every other particular year is recommended. In this age group, you can have it once a year or once in 2 years, but after crossing 50 to 74, you need to have it on a yearly basis. And after after 75 years, you may not have to go for a particular mammogram, because there are very less chances of a woman who has crossed 75 to get a breast cancer, because all the hormones are almost in a depleted form, and as such the particular woman of getting a cancer above 75 is very less. It doesn't mean that it will not get, but chances of getting are very small compared to the other age group. Preventive treatment. Some women are at increased risk of breast cancer due to hereditary factors. So you need to constantly check your breast, do the mammogram analysis on yearly basis based on your age group. If you have a history, a family history of a particular breast cancer. For instance, if your mother or father has a BRCA or BRCA2 gene mutation, then definitely you are at a much higher risk of having it as well. This significantly raises your risk of the breast cancer. So if any one of your parents has a mutation on these two genes, then definitely the genes are passed to the child, and as such you are also more prone to breast cancer. Also, if you are having a particular daughter, then also there are chances of you may be passing it to your daughter as well. So you need to make your daughter also aware of the same thing for the daily or regular testing. So these are some preventive steps that you need to take. So lifestyle changes is very important. Regular screening is a must so that you can detect it early in the stage, and accurate measures can be definitely taken. And preemptive treatments are with a family history background or gene mutation in one of your parents may be responsible for that. Now, how you can do your breast self-examination? So, in the step one is begin by lying on your back. Place your right hand behind your hip with the middle three fingers on your left hand, not the tip area. Gently but firmly press down your using small motions to examine the entire right breast and apply different pressures. Do circular motions from outside to inward, particular movement from moving towards the areola and the nipple area. Okay, and repeat the same thing for your left breast. Okay, spend about 5 minutes on each breast to explore each area to feel any lump, pain, or unevenness. And ideally time for doing it is after taking a shower. Okay, so what you need to do is you need to lie down like this, fine, and then try to particularly touch the area from outer region in a circular way and try to move it inside. And as you are pressing it in a vertical direction, you can move in this way, come down, then go up, come down. When you are in standing position, when you are sleeping position like this, lying down in this position, you need to monitor it in a circular area moving from outer region to the inner region. Use three fingers, the middle three, and try to press it in circular area. Take your own time to try to find some lymph node. When you are pressing, you may also come across some of your mammary glands or the lobules, which may look like a lump, but try to press them and see if you feel any pain. Try to check around surrounding region wherein you may find a similar lymph node. Okay, but if you find one area very big, one area little bit low, one area is painy, then it could be an indicator of something is growing. Okay, so manual inspection by inclining it and with your fingers close together, gently probe each breast in one of these particular three patterns. So this is the first pattern, this is the second one, and this is the third. Okay, in this you are moving from outer region to inner. Here you are going in circular, and here vertically downward, upward, downward. Okay, that is how you need to spend at least 5 minutes on one breast for examination. Mirror exam is another one. So stand in front of the mirror with your arms at one side. Look at the breast directly in your mirror. Look for changes in the skin texture, such as the dimpling, which I have already shown, puckering, then indentation, skin that looks like an orange peel, okay, any discoloration that you have seen. Note the shape and outline of each breast. Compare one breast to the other breast. No doubt one of the breasts may be sagging, but significant amount of change, if it is noticed, you will be able to detect it early. Okay, check to see if the nipple turns inward, that is inverted nipple. Do you do the same with your arms raised above your head for the other breast? So this is how we are supposed to do it. Is fold your arms like this. Keep one hand at the back of your head. With the other hand, you need to check your breast, your nipple area, your areolar region, your surrounding area. Okay. Stand in this position. Observe the particular both the breast for the symmetric nature. If you find one of the breast is swollen or not, okay, or one of the breast is sagging or not. Sagging can also be checked by little bit bending, so that let the breast come in a sagging position. Try to find out if one breast is sagging more compared to the other one. So that could be a result of inflammatory or some sort of an extra weight that has been growing inside in the form of a tumor that is causing the sagging. Okay, and also in this position, try to check your breast also in the circular area. So checking a lymphatic node in standing and sleeping will also be an indicator. So suppose in the sleeping or half inclined particular position, if you are finding some lump in one area, check for at the same location by doing the test in a standing position. So that will be little bit give you more clarity. So this is self mirror examination that you can do. And these are some of the symptoms that you see here. That is the lump in your particular underarm that you see here, lump in your neck, because this is a swelling of the lymphatic nodes. Okay. Then here Under chin also you may find a swelling. So these are all symptoms that it has spread through your lymphatic node and it has gone to that particular place. Fine. So that is very, very important. So this covers my session on the breast cancer. I hope that you have gained a good amount of knowledge of it. Early detection is very important. I would suggest you do a particular breast examination yourself every monthly after your menses has stopped, after the bleeding has stopped, and maybe you can also repeat it before the start of your next period. So this examination is to be done on every monthly basis and note down if any uneven changes that you see, and if it is more significant like the one that I've explained, then immediately report to the doctor and then the immediate test can be carried out and a supporting treatment can be started well in advance so that definitely it can be cured 100%. Today, breast cancer is no longer a big stigma or a cancer to be feared of. Only the thing, awareness is very important. A constant checkup by yourself is very important. And if detected early, in the early stages till stage 3, definitely there are very high good chances that are available of a survival rate and living a normal life. So with that intention, this session was planned and I hope that you have got a knowledge about breast cancer at different levels and I hope it will be useful for you. Thank you for your time.